Great. Well, good morning and welcome everyone to our Engaging with Evidence session for today. For those of you who don't know me, I am Jess Reedy and I work at the Government Outcomes Lab at Oxford University, and I'm the Senior Policy Engagement Officer, which means I have the pleasure of taking all of the team's very hard-found academic research insights and trying to translate them into things that are accessible, usable for practitioners, for policymakers. And this is part of what I do in my day-to-day. So engaging with evidence is very much in line with that. John, can I get you to pop up the slides, please? Wonderful. I hope you can all see that. If any of you have any trouble today, any technical difficulty, I've got my wonderful colleague John on the line, and you can just drop him a message in the Zoom chat and he will be there to help you out. So today we will be talking about lessons on outcomes contracting in mental health and employment. If that's not the session you expected, this is your chance to disappear off. Next slide, please. So who are we? For those of you who don't know, and it might be your first time, I see a lot of familiar faces, but there's also some new ones. We're the Government Outcomes Lab. We call ourselves the Go Lab. We were established back in 2016 in a partnership between UK government and Oxford University. And we really care about looking into how can government achieve meaningful outcomes? What are the mechanisms for that? What does it look like to have meaningful outcomes at the heart of partnerships with other sectors? And we started by looking very specifically at one mechanism for this called a social impact bond, or a SIB. The language has actually since shifted around this. So today we're referring to that mechanism as a social outcomes partnership. So if anyone's confused, at some points in our reports in the past, they were called a SIB. They're now being called a SOP. So if you hear those, don't get worried. They're exactly the same thing. And basically, they are a tool for outcomes contracting, which the whole point of that is to put outcomes at the heart of policy, making sure that meaningful outcomes are being measured and that payment is tied to that, and a social outcomes partnership. And the language around that indicates a shift from where before we used to think of them as just more of a punitive tool for as a financial mechanism, particularly with an emphasis on this bond language. But instead, we now have this partnership that we've increasingly found in our research is actually really core to the mechanism. And so an outcomes partnership reflects this shift in language where we've seen, basically aligning with our research, that partnership about putting outcomes at the heart, about bringing different actors from across different sectors to deliver the same outcomes, all of that is sort of caught up in the language that we now use. And at Go Lab, we first of all started as a team by looking at this tool, but actually our work, as the language has changed, so our work has also expanded to look more generally, what are the key factors for being able to work meaningfully and impactfully across partnerships, across sectors? What are the main tools for this? And today, as we look at some of the research around this, hopefully that's still at the heart, and that will come across to you, that we really care what are the takeaways that you can take as policymakers, as practitioners, as academics. What are the wider learnings beyond just the mechanism itself that can be implemented elsewhere, that we can take forward in our work and can make a difference? So that's the Go Lab. Next slide, please. And I think a lot of you will be familiar with our Engaging with Evidence series, but basically at the Go Lab, as you might expect for Oxford University, we care deeply about high quality, neutral evidence and research to be able to help inform best practice, best policy. And so this whole series came about with a heart from us to be able to share what is the latest research, the latest evidence in the field, our own and also others. And then how can we have like a really constructive conversation around that? So for these sessions, we always have a panel of experts, but it's rooted in a piece of recent research or evidence. And we really care about making sure that then they're a really interactive session. So we'll have people in the room today who know a lot about outcomes contracting, know a lot about this work. We'll have people who are just new to this and are starting to know some more about it. but we're really aware that there's a lot of expertise in the room, that we've got a global audience with all sorts of depth of knowledge. And so we care about hearing from you. So please do make the most of the Zoom chat today. As if you have questions as they go, pop them in. We'll have the second half of the session is all going to be an interactive panel Q&A. So make sure you've been getting your questions ready for that, because I'll be coming to you guys as the audience. And if you have thoughts as well as we go, pop those in the chat. We'll be keeping an eye on them, and I'll be coming back to those questions that you put in the chat as we get further along. And you can sign up to our monthly newsletter if you want to keep up to date. We'll have more throughout the year of this series, looking at other bits of the latest research and evidence around the world. Next slide, please. So today we are going to be first of all hearing from one of my colleagues at the Go Lab, Emily, who is the author of our report that we're rooting today's research in. And then we will go to our wider panel of experts, but I will hold off on introductions for them until the second half of the session, so it's nice and fresh in your minds. Next slide, please. Great. So if you could take the slides down for a moment, this is the moment where I begin with that promise of it being an interactive session. I'd love to invite you guys to introduce yourselves in the chat. It'd be lovely to hear where you're joining in from, who you are. We always do this, so this may not be a surprise if you've joined before, but please take a moment and share. Hi, Amita. Nice to see you joining from Hamburg. We've got Emily coming. Yep, nice. And we've got John. Hopefully for some of you, you can actually see I've got my nice Oxford buildings in the background. So I'm joining from Oxford. We've got Louise also in Oxford joining from Social Finance. We've got Grace coming from Bridges. So you've got Alec in London, Ian in Scotland. We've got Nikki joining from Bridges Outcomes Partnership. We've got James coming from London. See, we've got some people from Denmark. We've got Belgium. We've got Hungary. Hello and welcome to you all. We've got a few more Londoners. It's great to see. Vienna. Hi, Antonia. Nice to see you. Antonia was visiting us previously. We've got Stockholm. Fantastic. Please do keep introducing yourself. Hi, so nice to see you all. And feel comfortable, get used to that chat. So as you can see, we have a really global, really interesting audience, and we want to make the most of that. So please be ready to engage, to interact. John, can I get you to pop those slides back up, please? But please do keep going in the chat, introducing yourselves. It's so nice for everyone to get to see who is there with one another. Next slide, please. So today, very shortly, I'll be handing over to Emily, who will be presenting on the Mental Health and Employment Partnership. But I thought I'd just do a tiny bit of context setting before we kick off. So I've mentioned about a social outcomes partnership, what that is, that was previously called a social impact bond. They're the same thing, and they're a tool for outcomes contracting, putting outcomes at the heart of policy. The Mental Health and Employment Partnership is actually a programme that is delivered under the Life Chances Fund. It's one of 29 programmes that run throughout England. The Life Chances Fund is a £70 million outcomes fund, supporting these 29 programmes, looking at trying to improve life chances, kind of obvious in the title, for vulnerable individuals in all sorts of different contexts. So it crosses a lot of different policy areas, and this is just one of those. And it's worth us mentioning that it is delivered by the Department for Culture, Media and Sport, so UK government, and I know we've got a number of them on the line today, so I'm sure they'll be able to engage in the chat. And that it's actually managed on the ground through the National Lottery Community Fund. So those are the two logos that you'll be seeing on the screen. And then us at Go Lab, how are we involved? We are the actual knowledge and learning partners for the Life Chances Fund, which means we've been working very closely with UK government in a really unique partnership, which is so exciting, over the last 7 years or so, helping share what is the latest research, the latest learnings, how can this help a practice, how can we drive things forward, and this is all part of that partnership. So without further ado, let me hand over to Emily.
Thank you, Jess. It's an absolute pleasure to welcome everyone today. Good morning. My name is Emily Hulse, and I am a senior research associate here at the Government Outcomes Lab at University of Oxford, and the primary author of this report that I shall be presenting. On the next slide, you can see that this is my aim of today, to summarize the key findings of our second report of the Government Outcomes Evaluation of the Mental Health and Employment Partnership, which has been commissioned under the Life Chances Fund, which is a central outcome fund. Next slide. So I will talk about introduction and why should we care about mental health outcome-based contracting. So people with severe mental illness or specific learning disabilities have some of the lowest employment rates in the UK. It's approximate 8% of people in contact with secondary mental health services are in paid employment, despite studies showing that 50% are capable of work. Research has established that individual placement and support, otherwise known as IPS, is a specific strategy that first places users into jobs and then provides in-work training. This has superior labour market employment outcomes when compared to more conventional vocational programs for people with severe mental illness. So rather than a train, then place approach, IPS places people into employment and then trains them ongoing. So ultimately, there were questions around 2013, around 2014, about how to commission and scale high-functioning IPS appropriately in the UK. And on the next slide, we can see where Mental Health Employment Partnership comes in. So the Mental Health Employment Partnership, or MHEP, was established in 2015 to drive the expansion of high-quality employment support programs in the UK based on this individual placement and support model. And we can see that the MHEP, or the Mental Health Employment Partnership, is a company run by social finance, and it facilitates the rollout of 9 local social outcome partnerships. So these projects each meet the definition of a social outcome partnership, as Jessica mentioned, which is a contractual relationship, which includes 2 core factors. The first one is that, obviously, there is a payment for an outcome achieved. So this could be a social outcome, this could be an environmental outcome, this could be a health outcome. So ultimately, an outcome contract. And the second part is upfront repayable finance provided by a third party, usually a social impact investor, in which the repayment is conditional on achieving these specified measurable outcomes. And in other words, this is also referred to as a social impact bond in the UK. And on the next slide, I'm just explaining some of the actors in this social outcome partnership, because it is a partnership. It's a partnership between public, private, and voluntary sectors, and so it involves a range of actors. So firstly, we have social finance. So social finance is a not-for-profit consultancy, but in this case, they act as a co-commissioner or a third-party intermediary, which manages the performance of this partnership as well as the contract. Second, we have Big Issue Invest, which is a social impact investor, which funds the upfront working capital for the IPS services. Next, we have the providers. Here are the third sector VCSE providers. And we have the local commissioners. So the local commissioners are providing the majority of outcome payments if the outcomes are achieved, while the Life Chances Fund, a central government outcome fund, provides minority contribution to the outcome payment. So if the outcomes are achieved, that they will provide a slightly less of a proportionate outcome payments. And on the next slide, we can see what are these outcomes I keep referring to that are tied to payment. So there are 3 main payable outcomes in the Mental Health Employment Partnership, Social Outcome Partnership. So the first one is engagement. So the providers and MHEP are paid if individuals engage with the IPS service and complete a vocational profile. The second payable outcome is a job start. So providers and MHEP are paid if individuals spend one full day or 4 hours of part-time work in paid competitive employment. And lastly, the third payable outcome is job sustainment. So individuals sustain paid competitive employment for at least 13 weeks. And next we'll go into the methods of this report. So the predominant question we're asking in our longitudinal evaluation of MHEP, we've been running this since I think 2020, so quite a while, and it has involved multiple iterative phases of qualitative and quantitative research. So our research question is, did the mental health or MHEP social outcome partnerships, specifically the outcome contracts and this performance management function, make a difference to the social outcomes achieved compared to alternative commissioning approaches for IPS? And following from this, through what mechanism does a social outcome partnership-based IPS service contribute to these evidence impacts? And on the next slide, we can see that this is a longitudinal evaluation. So we have completed phase 1 and we have completed phase 2. So they are 2 juicy reports to read. And we are currently in the process of publishing our last report. So in terms of phase 2's methods, on the next slide, we can see that, the aims of the second report. On the next slide, we can see that there are 3 main aims. So the first one is to explore the perception of the social outcome partnerships, financial resources, the collaboration, performance management, to further test a theory of change revealed in our first report. The second aim is to analyze the implementation experience of the social outcome partnership according to the actors, to unpick how can a social outcome backed service contribute to these impacts compared to traditional commissioning approaches. And lastly, we also analyze the performance data of these key outcome metrics through time. And in this report, we have a multitude of different methodological approaches. We have documentary analysis, we have observations of over a year, we have 27 qualitative semi-structured interviews, and we also have outcome analysis. And if we go to our next slide, we can see that their structure of the report is based on 5 main key questions. The first one is there greater accountability in a social outcome partnership than traditional commissioning? And hopefully this webinar will also tell you the answer to this. The second question is, does the social outcome partnership affect service quality? Do the frontline services are affected by this kind of new way of working in terms of the quality of delivery? The third question is, how did the structure of the social outcome partnership affect service delivery? Does any design specifications of the outcome-based contract, does that affect service delivery? Should we be mindful about what contract specifications we're putting into these new outcome-based contracts or a social outcome partnership? The fourth question is, through what incentives do the MHEP social outcome partnerships operate? And the last question is, does MHEP have a legacy, not only for providers, commissioners, but the entire IPS sector? And in the next slide, we can see some of the results. So the main results that I want to talk about today is 2 distinct benefits and 2 distinct challenges. So the first benefit of the mental health employment partnership SOP was a greater accountability compared to traditional commissioning, and also legacy effects. And the 2 distinctive challenges I want to talk about are some of the complexities and unfamiliarity of this approach, as well as some of the muted incentives. And so firstly, in terms of one of the main benefits we found about this approach was that there was a greater accountability in the social outcome partnership IPS service compared to traditional funding of IPS. So those that were interviewed found that accountability occurred as a result of 4 key factors. So this was firstly, continuous monitoring of outcomes. The second was more contractual levers in the outcome-based contract to respond to underperformance. Thirdly, a high commissioner involvement. higher commissioner involvement in the social outcome partnership compared to traditional IPS contracts. And lastly, active problem solving. So this greatly differed from traditional commissioning. And I think there's three main quotes here from our interviewees, which really emphatically compare the partnership approach to their traditional contracts. So firstly, we have comparing to non-MHEP services. I was shocked to find out that some services literally don't give any reporting to their commissioners. A second report reveals from a provider that the traditional commissioner, as far as I can see, doesn't have that kind of involvement. You might think that's a nice thing, that they're not here to pick apart what you do. But then you're left thinking, am I doing a good job? I think having a commissioner who takes a healthy level of interest in what you're doing is much more positive. And I think if we hadn't had that interest from MHEP, I do wonder if we'd be running as well as we do now. And the third quote is also from a provider who states, without that monitoring and without that relationship that they found with MHEP, I don't see how you can be confident that you're getting the service that you commission. On the next slide, we can really unpick of what commissioners and providers appreciated about this accountability compared to traditional contracts of IPS. So firstly, in terms of continuous monitoring. So traditional contracts lacked frequent and rigorous monitoring, allowing underperformance to persist without timely intervention. Commissioners admitted that previously, in terms of block contracts, they wouldn't intervene necessarily for poor performance as quickly as they did with MHEP. Commissioners in local authorities and the NHS commented that this was one of the biggest lessons from their experience with the MHEP Social Outcome Partnership. The formal accountabilities in the MHEP Social Outcome Partnership included the use of outcome payments, as well as a series of planned steps for underperformance. And these were regarded very positively by commissioners. Local authorities admitted that they're not very good at penalty clauses for underperforming. So with a series of planned steps for a situation of underperformance by a service provider, the MHEP arrangement was seen as better prepared and more proactive. In traditional contracts, a key sanction is to terminate the contract, but actually this is rarely used. And therefore, according to commissioners, when the outcome-based contract is done right, the performance payments and the multiple steps to deal with underperformance means that it's in everyone's best interest to perform. And you can really start to lever and leverage some of these performance management functions, as well as contractual functions, to incentivize and motivate performance and accountability. On the next slide, we really shift into the provider's perspectives. So provider staff described feeling demoralized in previous IPS contracts. And this was a sense that commissioners were perhaps disinterested from what they were doing day to day, or even quarterly, or even annually. Several provider staff drew attention to the recognition and praise offered by MHEP during their social outcome partnership, during periods of high performance or performance recovery. The MHEP's team's ability to ask the right questions was a skill that providers really valued. And staff highlighted that meaningful accountability conversations arise when commissioners know IPS well and therefore know why performance may fluctuate. The other aspect of accountability that service providers really appreciated was the ability to actively problem solve in MHEP contracts. So this was related to MHEP's ability to use any data analytics in managing performance. For instance, the MHEP team would start to break down employment outcomes per employment specialist, or according to their best month in a previous year. So this facilitated more targeted conversations with the providers team on what you can learn from staff members who are doing well as what you did previously. And the MHEP team hoped that this would set a new precedent for providers and commissioners on a very subtle but very powerful cultural shift in IPS contracts, which shift from compliance of a contract to learning in a contract. And what was really powerful is that in interviews, commissioners really stated that this really shifted their mindset when commissioning future IPS contracts. On the next slide, we can see that in light of this great benefit of greater accountability, that there have been some challenges. And one of the main challenges of social finance's approach to managing the social outcome partnership of MHEP is the complexity of the contracts and the funding flows. While some perceive that complexity can be expected in a new contracting structure or a new way of working, many believed that much of this was perhaps unnecessary or avoidable. And there were some implications of this complexity noted in the interviews. Some of them were losses in outcome payments, a reduced motivation, and also frictions in some of the mission alignment. On the next slide, we can see that here are the main sources of the complexity. So there were a source of complexity from negotiations between the Life Chances Fund, the central outcome payer, and the local commissioner outcome payer, as well as the social finance managing all these payment flows. And so the different negotiations meant that different commissioners had different preferences of payment timings, of payment amounts, and what they were willing to pay on. And this added a layer of complexity. Another source of complexity was perhaps a lack of clarity on the reasons and justifications for certain payment flows. And particularly this was exacerbated by turnover. And another source of complexity was analyst interpretations and financial modeling, and just how difficult it is to perhaps run pragmatically an outcome-based contract, and how difficult it is to monitor and predict outcomes, particularly for these stakeholders. On the next slide, we can see perhaps some of the solutions to reduce this complexity. So the first one that interviewees recommended was ensuring early buy-in of social outcome partnerships, but particularly the principles and design specifications, and remind new members if there is turnover. The second one is acknowledge that adaptability and a learning mindset, which is particularly important, are essential in dealing with unexpected events such as NHS transformation and COVID, but also a partnership approach. The third solution to reducing complexity is acknowledging the challenges in forecasting outcomes, particularly in areas of complex social needs, and recognize that these outcomes may change over time. And this requires managing expectations over the monitoring requirements, particularly of the governance boards, the commissioners, the Life Chances Fund, etc. And lastly, the fourth solution to reduce complexity recommended by the interviewees was addressing the issue of an annualized payment cap in outcome-based partnership, as outcome-based partnerships may not be compatible with a rigid requirement to spend in line with forecasts, when actually the actual expenditure might come up and down depending on outcome achievement. So solutions to reduce complexity. So unsurprisingly, many emphasize that action taken at the start of a contract or joining the role within the partnership could alleviate this perceived complexity or unfamiliarity. Communicating the rationale between design and negotiation choices and cultivating a learning culture can reduce misunderstandings between actors. And this was a particular area of improvement of MHEP and also a key priority and focus. So we have a quote here from a provider stating that, so maybe the people who had negotiated the contract, it would have been good right at the beginning to have a really clear introduction and understanding for the operational side of what the contract means and how it's going to work. Upon reflection, it took us a year to properly get used to it and understand the social outcome partnership. And on the next slide, we can see some of the caveats to reduce this complexity. So interesting, when asked if complexity reduces over time due to a learning curve or could be reduced with perhaps these dedicated solutions, many interviewees were kind of a bit torn about whether this would indeed decrease. And many stated that it would likely stay the same or increase for several reasons. So firstly, longer duration of contracts. So longer duration of contracts may mean more room for error over the 5 years of outcome modeling, as projects deviate from initial forecasts or invoicing instructions were complicated over the 5 years. Secondly, we have unavoidable difficulties in outcome performance forecasting, especially for the complex area of social needs and the intersection of mental health. And this is perhaps something that's unavoidable. Next, we have the changeable BCSE delivery landscape. So assumptions won't hold for referral pathways, NHS transformation, or senior level support due to the dynamic way the NHS and social care works at the moment. Fourthly, constant adaptation is almost required to respond to the variation using data. And lastly, we have theoretically actors would become more familiar with the model of social outcome partnerships. However, invoicing for different amounts depending on performance still requires a cultural shift, and we haven't necessarily seen that just yet. The second challenge I want to mention today is incentives. So MHEP Social Outcome Partnerships were expected to operate through strong traditional financial incentives from outcome payments. But MHEP's financial incentives were more muted for providers than expected due to four main reasons. So firstly, outcome target design problems. Providers did not internalize some of the performance targets, especially if they were deemed too high or not feasible. Where the annual payment cap was too low, the payment threshold would not be met or would be met early in the year, meaning that outcome achievement beyond this point was not rewarded. Next, we have greater intrinsic motivation of the frontline staff. So frontline staff in provider organizations were very client-focused, and provider leadership teams felt the need to shield frontline staff from outcome targets so that employment specialists could focus on delivering IPS well. So managers made a conscious choice to absorb the pressure of outcome payments. Next, we have the lack of direct payments. So frontline staff were not directly rewarded for outcome achievement. Outcome payments were not bonuses for individual staff, but for the organization, which was quite removed from the frontline staff delivery and more at the higher management level. So even at the organizational level, the incentive and outcome payments were moderated by a low proportion of outcome-linked payments. And last, we have a lack of clarity or contractual complexity. So many frontline staff didn't necessarily comprehend the amount of payment per outcome, nor the need to provide evidence of outcome achievement. And next, we have just some of the caveats of this outcome-based incentive. So MHEPs exposed providers to comparatively low outcome-related payments, ranging from 0 to 30% of their contractual value. So under MHEP, therefore, there was a more subtle approach to paying for outcomes, which ensures that providers still have skin in the game on performance, but limits some of the established drawbacks of a payment by results approach. On the next slide, we can see what did incentivize providers under MHEP social outcome partnerships. So in practice, providers seem to respond less to the outcome payments per se, but more to setting internal benchmarks for performance. So social finance comparing providers to previous personal bests. Also, the experience of efficiency gains from the improved use of data motivated the frontline staff to be more involved with the social outcome partnership. And lastly, the growing trust and alignment between providers and the central MHEP management team allowed providers to be more motivated to give more data, to strive for better achievement, and to strive to do best for their clients. Overall, there were mixed views on the appetite of use of outcome-based contracts or social outcome partnership in all IPS contracts, as one might expect. However, interviewees were mostly in favor of future outcome-based contracts, provided that payments were a low proportion of contract value and targets were achievable yet ambitious. On the next slide, I wish to talk about legacy. So while there are varied beliefs on whether the benefits were long-lasting, stakeholders consistently described the capacity development experienced as part of the project.
Hi, Emily. We seem to not be hearing you anymore. I just wanted to check in. Okay. Can everyone else hear me but not hear Emily at the moment?
Yeah.
Yeah. Okay, great. She's just rejoining. So if you bear with us 1 second, and we'll see if we can get it going again.
Apologies for dropping off.
That's all right. Your video seems to have frozen a little bit, but I think we can hear you again.
Okay, perfect.
We are a bit almost at time for the panel conversation anyway, so it'd be great to hear your final wrap-up thoughts, and then we can move on.
Perfect. So just finally, there were some legacy effects of the MHEP. So for providers, MHEP brought an enhanced capacity through talent pipelines, IT systems, and dependable data routines. And on the next slide, we can see for commissioners, there was a creation of a new baseline of what is expected for IPS services, and also this experience in partnership working. And if we go to the final slide. Perfect. So overall, MHEP has left a powerful legacy in being the world's first social outcome partnership aimed at helping people with mental health issues into paid employment. It was also the longest running social outcome partnership globally for a record-breaking of 9 years. It was also the creator of IPS Grow, an implementation support network to support the NHS scale-up of IPS across the country. And lastly, it was a partner to third sector providers who perceived a more accountable IPS service and who ultimately described that we will miss them. Thank you, Jess. I'll pass it on back to you.
Thank you so much, Emily. That was brilliant. And it was so great to hear your research. And I thought you did such a wonderful job of it, even though it froze partway through, you immediately managed to sort that out. I wanted to just take a moment and see if anyone has any questions for Emily. If you do, you can use the raise hand function, or you can pop them in the chat. There's no pressure if not, because we will move on to the panel conversation, but I wanted to just take a moment. Great. In which case, clearly you've done an excellent job of explaining everything. I would love to get my panel up for us now. So John, if you could spotlight our panelists. So we have just heard from Emily about some of this really specific program, delivering an outcomes approach in the space for mental health and employment. Generally, as a policy area, this seems to have come again back slightly more to the fore, with a white paper recently released in the UK just before Christmas, highlighting just how much of an issue it has been of people being out of employment who may otherwise be eligible for it due to mental health limitations. And so it seems like a really salient time to be having this conversation for this report to have come out, having a look at how is this helping with issues around like accountability, as Emily has shared, how it may have helped with things like life learning, challenges that may have risen like around complexity, but again, some really helpful suggestions there of how that might then be overcome better. And then we've got our panel here who I think will be really great for helping us pull this out into this wider conversation. So we've got Madeline, Russell, and Shamsia, who in a moment I will get them to introduce themselves and share who they are, what they do, and also what they are bringing to the panel today. So, Madeline, let me come to you first. Would you like to introduce yourself?
Yeah, thanks, Jess. And yeah, thanks for such a great presentation, Emily. It was really, yeah, I've read the report, but it was great to hear you lay it out like that and bring out some of the pieces of your research to set up for this panel discussion. So my name is Madeline Goldie. I am a project manager at Social Finance. Social Finance is a nonprofit. We bring together innovative finance, strategic insight, design tools, data and digital lab together to try and drive system change across a wide range of different policy areas. And one of those policy areas sort of almost 9 years ago now was MHEP. And so we were part of those early discussions to set up the MHEP project. And subsequently, as Emily pointed out, we were the performance manager for MHEP as well. I'll be reflecting a little bit today on my role as the leading the performance management team over the final 18 months of the project. And yeah, really excited to be among such esteemed company on the panel today, and yeah, looking forward to the discussion.
Thank you so much for that. Brilliant. So Madeline will be able to really answer if you have any questions for more of the close to the project on the ground. She will be your go-to person today. Russell, can I invite you to introduce yourself next?
Yeah, morning everyone. And yeah, I'd like to start off echoing what Madeline's just said, Emily. I think a really good presentation and a really interesting and useful report. So thank you very much. My name is Russell Jones. I'm the Assistant Director for Integrated Commissioning at the London Borough of Southwark and South East London Integrated Care Board. So what that means is I work across health, social services, public health, and I manage a team of people that for an area of London make sure we have the right services in place and that those services are performing well. And part of that portfolio includes the mental health employment support. So I'll be offering some reflections today about lessons for commissioning beyond an outcomes contracting model from this. And sort of, I think there's some really interesting points in the report about partnerships and intrinsic motivations and how we draw on those as much as contractual levers in a kind of hard sense.
Thanks so much for that, Russell. So as you just heard, Russell is very much in the local government context, having to try and apply some of this day-to-day learnings and challenges around how to deliver employment support for those struggling with mental health, as well as if you have questions for him more broadly, a lot of rich insights from other areas of his work. Shamsia, can we come to you last but not least to introduce yourself?
Thanks, Jess. You can indeed. And again, echo everything that Russell and Maddie have said about the presentation and the report, Emily and team. Well done, and really great to be here, part of the panel. Thanks, Jess, for the invite. So I'm Shamsia Ali. I am an independent consultant and visiting fellow of practice for the GoLab. Over the last 20 plus years of work, my career has predominantly been around outcomes-based contract, and the first 10 years of my working career I have spent on outcomes-based contracting in the employment sector. So delivering frontline services that were paid on results, as well as being on the commissioning side, leading local government, Brent Council, Haringey Council in commissioning employment services as well, including an IPS light model whilst I was at Brent Council, oh God, over 10 years ago, possibly. More recently, I've been in the international development sector over the last 6 or so years, again around outcomes-based contracting and with mental health being a running theme in all of this. I'm hoping to use some of my sort of experience and past knowledge to help decomplex, if that's even a word, outcome-based contracting in the employment sector, particularly for job seekers with additional or complex needs such as mental health or severe mental health, as is on IPS. Thanks, Jess.
Thank you so much, Shamsia. And so you've already met Emily, and this will be our panel for the rest of the session. Just a little bit on house rules. This is very much the opportunity to hear from all of you who are joining us today. If you have questions, you have reflections, you can use the chat, so feel free to put your questions or your thoughts there. You can also use the raise hand function on Zoom, and I will come to you. So we'll be handing over to all of you very, very soon. But to kick things off, clearly we've got a really nice variety of people and perspectives on our panel. I would love to hear, perhaps we can come to Madeline first, and Shamsia, I know you wanted to pick up on this point. Madeline, you've shared that you've been very much on the ground. You've been doing a lot of the performance management of this program. Emily has just shared a lot of some of the wider learnings around this, and also some of the benefits that seem to have come out of like some of this live learning, especially for commissioners. It'd be great to hear a little bit from you about your experience of performance management versus contract management and balancing those. And then maybe Shamsia, if you have any reflections, it'd be great to hear a bit from you too.
Yeah, happy to share some thoughts. Thanks, Jess. So something that I thought was really great about the way you presented the findings earlier, Emily, is yeah, I think you picked out what I think I agree are the most interesting parts of MHEP. That's what made it unique both to traditional contracting, but potentially also unique to some other outcomes-based partnerships as well. And one thing that I wanted to pick up and emphasize was, I think, the important role of the muted incentive, I think in your language, around outcomes payment incentives for providers, which I think was quite an important design element in the end for MHEP's success in many ways. And that's because although in the second phase of MHEP, which is the subject of this evaluation, there was a smaller amount, or there was a smaller portion of the total contract was contingent on achieving outcomes, but MHEP as a vehicle, MHEP as a commissioner, still was very exposed to those outcome payments, and so the risk was borne by MHEP rather than providers, and that was interesting because it actually meant that MHEP had this very strong incentive to develop the right mechanism to support providers to deliver those outcomes in a way that I think forced us to get sort of quite sophisticated and nuanced about what is the right function for MHEP to play in providing that performance management support. And I'll talk about that in a moment, but I think what that enabled us to do was really split out the contract management function from the performance management function, which I think Shamsia will talk a little bit about, but I wanted to emphasize that I think that was quite a neat part of how we were able to work, not in least part because you have different people in the room for those discussions, and it meant that we were able to bring our performance data to the folks who were actually driving the performance of these MHEP services, who are often the caseworkers and the team managers who are on the ground, and we were able to think about, or we were sort of pushed to think about, what is it that is useful to those for those conversations, and how can we make this data really useful for the folks who are actually doing the operational troubleshooting and are sort of on the ground. And I think that was a really that meant that we were, I think, able to produce really, really great. I think that improved our function as a performance manager. And I wanted to say quickly that yeah, I think I wanted to re-emphasize a point that you made, Emily, about the kinds of data that we shared, and that we sort of, that changed a lot over the many years of the MHEP program, and we sort of got quite nuanced about thinking about how to contextualize the data. And so instead of just showing, for example, the rate, the number of referrals coming into a service this month compared to last month or compared to previous months, we learned that actually that wasn't very meaningful, and providers would say, well, that's not actually giving you, this drop this month isn't giving you a sense of our performance. Actually, why don't you look at the rates last year at this exact same time of year? Because there's a huge amount of seasonal variation. The right comparison isn't last quarter, it's actually this time last year, or things like that. Or for example, saying, not looking at perhaps referrals in the aggregate, but looking at referrals by which referral source are they coming from. And those little things, I think, were some examples of how we got better at providing that performance management function over time, because providers were sense making the data with us. The other point I wanted to raise was another thing you brought up, Emily, was around the complexity of MHEP. And I think there was a lot of really interesting and important points that you raised there. But I guess I did just want to reflect on the fact that some of the complexity, as you noted, came from some of the negotiations about how MHEP would look to begin with. And there were dozens and dozens of stakeholders that we were able to bring around the table for MHEP, and in a highly sort of a fragmented funding landscape for services like IPS. I think in some ways we sort of quite miraculously were able to bring together dozens of commissioners across London and in Shropshire, the ICB, including ICBs, as well as local authorities, these national funding pools, and also the investors. And I think that complexity crept in because of the amount of stakeholders around the table. And so I think it's just something to reflect on, that, yeah, the complexity was an important thing for us to think about, like, what are the levers to reduce it? But I also think in some ways the complexity was what enabled us to bring so many people around the table, or was perhaps an inevitable consequence of that. I might pause there because I've talked a lot, but welcome questions from anyone as well in the chat. And we'll hand back to you.
Thank you so much. No, that's really great. I think especially that point around complexity, that it's not necessary. It could be easy to just assume that's simply a bad thing, but actually maybe it's a necessity or a good thing, like that's coming from bringing so many people together that otherwise would be really fragmented. Shamsi, I'd love to hear from you next, but also on this point of fragmentation, I think it'd be really nice to come to Emily and Russell afterwards, because I know generally that mental health support across the country, and even in very local areas, can be incredibly fragmented, which can cause a whole boundary and issue in and of itself. It'd be lovely to hear some more of your reflections or thoughts on this wider context. But Shamsia, let's come to you first, and then I'll pick up some of the questions in the chat after we've heard from all of our panel.
Great, thanks, Jess. And if it's okay with you, Jess, I'd love to pick up on the complexity point that Madeline made, and then talk about sort of the performance management and contract management, and then maybe we can go to Russell and Emily around the fragmentation around mental health. So just around Madeline, yeah, I love that little the angle about the complexity and all the stakeholders, and actually how it was really beneficial for MHEP, and I think that's a really important point to make, and a lovely way of seeing it. But also, I think I kind of almost want to take a step back, particularly for members of the audience for whom outcomes-based contracting and employment programs might be a new thing. And perhaps the introduction to it through MHEP might be sort of one of the most confusing way to introduce you to sort of outcomes-based contracting and employment programs. And so just taking a step back, I guess, is MHEP is particularly complex, and it doesn't necessarily have to be this complex in employment programs. And I think recognizing that outcomes-based contract actually is, in theory, and possibly it should be in practice, quite a simple concept, in the sense that the traditional way of funding the program moves from a sort of a grant, a fee for service, to paying for the outcomes that you achieve, the outcomes implemented the service provider achieves, and directly linking the payment to those outcomes. And employment programs actually is one of the most simplest form sectors to bring outcomes-based contracting in, just because the outcomes are so easy to identify and measure and record. You know, it is, as it was on MHEP, it is engagement with the service, it is that individual then going into work, and it is that individual then sustaining work. And so in that way, it is quite a simple program to contract as an outcomes-based contract. Where I think a little bit of complexity then comes in is when you bring in impact bonds, or as they're now called, social outcomes partnership. But again, it can remain quite simple. Impact bonds, social outcomes partnership is what another form of outcomes-based contracting. It's a form, a type, and it's a type where if the service provider needs working capital upfront because their payment doesn't come till later down the line, because they don't achieve, they're not going to hit the outcomes till later, and therefore draw down the money. Impact bonds are, social impact bonds or development impact bonds are a way of bringing that working capital forward for the service provider. And usually it could be private sector finance that's released, who comes forward as the investor, and they then get paid by the commissioner with the result. Again, that can be quite a simple form of outcomes-based contracting, and should be. I think, and I guess this is the point, is MHEP was particularly confusing and complex because you had a number of commissioners involved. You had your local authorities, or in Tower Hamlets, one of the cases in Tower Hamlets, the NHS, but you also had the Life Chances Fund. And so I guess I wanted to make that point to be fair to MHEP in terms of some of the complexities that were articulated, and actually it's not always that complex. And so the point I just wanted to make about performance management, which social finance are absolutely brilliant at and did a brilliant job, and I continue to do a brilliant job with on MHEP, is just the real nuance and very obvious difference between contract management and performance management, and how outcomes-based contracts really lends itself well to a performance management approach. And Emily, you used the term, I forgot the first half, but I think you might have said it's something MHEP moved from a monitoring contract to a learning contract. And it's that sort of learning element that is so brilliant about performance management, and the very supportive element. And this is where an intermediary like social finance sort of work hand in hand with the service provider. And I think performance management is quite distinct from contract management, because it's moving away from contractual compliance around, I don't know, invoicing and other things that you do with contract, to really focusing on operational delivery performance and embedding a performance culture within the service providers, and really focusing on impact at the individual service user level. And it's a real supportive, collaborative, ongoing process between the performance manager and the implementer. It's daily, it's weekly, it's monthly, it's really understanding what is working, what is not, and it's really coming in at the earliest point possible to identify the challenges and finding mitigating solutions for them. And it really is about that continuous learning. And I think that's what works really well in an outcomes-based contract in an employment program. It's that continuous learning that comes from performance management. That means that whilst you're focused on the outcome, the contractual mechanism allows the service provider to make changes as and when required in the implementation, in the delivery, because they are not being contracted on how to deliver, but actually the outcomes that they achieve. I know an IPS is slightly difficult because you've got the fidelity and you've got to adhere to the fidelity scale. But I just kind of want to emphasize, I guess, the real benefit of outcomes-based contracts in terms of performance management, and how that can be a real benefit to the service provider, the outcomes buyer, the commissioner here, but in particular, the end user here, the job seekers.
Thanks so much. No, it was great, Shamsia. And I think it nicely resonates with some of the things that Madeline was picking up, especially about how helpful the data was. I think in enabling some of that performance learning, that is something that we're seeing across the board with our research across the Life Chances Fund, and is resonating more globally about the use of social outcomes partnerships, about how they can allow for more flexibility, that they can enable this more partnership approach, but also that they can be, again, it depends on the context, and when done right, can be a really useful tool for live learning and improvement as you go, rather than like waiting till the end of a program, doing a review then and hoping that's implemented moving forward. This is often an enabling, or can be an enabling tool, especially because of the data piece as the programs are in flight. Emily and Russell, I'd love to come to you. I've given you some time to chew on that wider context piece of the fragmentation in this space generally. This has clearly been a partnership approach that's been taken, but it'd be great to hear your reflections on that. And also, if you have any reflections, I saw we had a question in the chat from Emily, your research, and Russell, your experience of what actually makes a good commissioner. I see that Madeline's picked up a little bit in the chat about this as well.
Yeah, I think so I think the landscape is fragmented about this, as with lots of public services. So if you look at the sort of employment world, obviously you've got sort of the central government sort of DWP job centre type services in the UK. Then you have local government who will be commissioning, you know, their own bespoke things, whether that's with a kind of local economy lens or with a more social care kind of social inclusion lens. And then of course you've got some health commission things as well. So I do think it's fair to say that there's a lot of space, there's a lot going on in this space. And I think, as you alluded to earlier, Jess, given the white paper and the kind of increasing interest in growth and hardwiring that into different things, I think we're going to see more iterations of that across different parts of government. And I think that comes back to the question of what is a good commissioner for me. So part of being a good commissioner, I think, is being able to step back and look at the whole landscape and try and think, where are you adding value, or what are you doing? So, you know, if you're a social care commissioner, how do you do something that fits into a gap that's not already there, versus rather than duplicating, or, you know, where do you look to pool budgets where it makes sense to do that sort of thing? I suppose on the question of what makes a good commissioner generally, I always talk about good commissioners, VERC, VERC in this case being an acronym. So V being about being visible, and I think that speaks to some of the things that Maddie and Chomsky were talking about in terms of that taking a more performance improvement and learning approach. So, you know, visibility helps you go and understand the service, go and see it. It also helps services to develop trust in you as a commissioner. You're not just this faceless email or sort of a stick to beat them with. Actually, you know, if you understand what a service is like on the ground, you meet the staff, you meet the people who draw on the service. I think that's really powerful in a sort of two-way street front. E of VERC is about being evidence-based, and to my mind there's kind of two bits to that. So partly around listening to people's lived experience, whether that's staff or again the people who draw on services, or some of that data. And I do think that actually good commissioning doesn't happen in a vacuum. And some of I think what the report helpfully surfaces is there's some really good enablers. So some of that is to do with data and some of that's to do with time. Good commissioning doesn't happen. Rome wasn't built in a day, as it were. R is about being relational. And again, I think that speaks to some of the lessons from this project. So what I mean by relational is sort of two-pronged. Partly it's about being able to, as people have alluded to, work flexibly and sort of work collaboratively with providers, and recognizing that providers have expertise to bring to the table. So it's not a top-down, I'm the commissioner, you're the provider, you'll do what I say type thing. But it's also about sort of again, taking the time and to build trust with people, because I think some of the performance, there was a question in the chat about carrots and sticks. I think the best performance things I've had is where you can have a common picture of what's going on, and again, where people feel confident to be upfront about where there are challenges. And I think part of your role as a commissioner is helping people to roll your sleeves up and help them solve some of that, and doing some of the system leadership piece where that might be needed. And lastly, Q is about quality for me. So that's both about the quality of the commissioning. So are you doing a good job of being interested and so on, but also about the quality of the service, and thinking about that in lots of different ways as well. So KPIs will tell you some parts of it, but actually there's other things around. Again, how do we hear from people drawing on the services about what they value and so on and so forth. And I think the last thing I would say is, I think being a translator and a connector is a really important part of being a commissioner. So often in the fragmented landscape, if you're facilitating a conversation between an NHS trust, a housing association, a voluntary sector organisation, and a social care thing, people are ostensibly talking the same language, but actually they all have their different professional things. So actually being a good commissioner is often being able to try and understand what each party is saying and translate that into a sort of plan of action that people can work to. So sometimes that's called system leadership, but to me it's about being able to translate and to connect, really.
Thanks so much for that, for Russell. It was a really nice way of framing, I think, generally what good practice should look like. And I think some of that really resonates with what Emily was talking about, but I think it's a really nice way of articulating perhaps some of these learnings that can go beyond just a SOP model, that they're not necessarily tied to this model, they can be enabled by this model, but that these are general good practices for doing commissioning well. Emily, let's go to you.
Perfect. And I'll try and be quick. I think the first thing on fragmentation and then the second on good commissioning. So firstly, fragmentation. I think as many of us may be aware, like IPS is funded through different commissioners currently, like centrally through the office OHID and DWP, as well as through the NHS, through the local authorities, as well as a lot of these kind of smaller funding pots coming from some of these national trials. And I think what was really phenomenal about MHEP, at least from a research perspective, is the platform approach to social outcome partnerships. So MHEP having a special purpose vehicle allowing for different social outcome partnerships to be added over time meant that it was really easy to scale up IPS and really scale up this partnership approach. And so I think one thing, and I think that did help with fragmentation of funding pots, or fragmentation of knowing what to expect, knowing which KPIs to focus on, because each funding body has a different KPI. And the fact that MHEP said, okay, we will do the coordination function, we will pull the funding pots, here are the outcomes you need to achieve, this is how you measure these KPIs. I think that allowed quite a streamlined focus approach to the providers, which I think they greatly appreciated. And I think that's something that perhaps will be quite missed in the IPS sector. And I'm really looking forward to, commissioning approaches of IPS to really kind of tap into this pooling. I'm not sure how, so that would be a question for another person. In terms of what a good commissioner is, I mean, I'm not a commissioner, so I don't exactly know from firsthand experience, but at least from the research, and this is really in the report, of what a good commissioner is of IPS and under a social outcome partnership in particular. And it really picks up on what Maddie and Russell said as well, and I think Shamsia. So it's someone that's really responsive and highly engaged with the performance of the service. I think that's really important. I think that's what providers really appreciated about this partnership approach, because MHEP, as a co-commissioner through social finance, was very engaged, but also the NHS and the local authorities really started to step up and go, oh, wow, okay, there's a lot of focus on this service. Like, what do we need? And meeting regularly, a lot more regularly than in their traditional contract. The second one is like or strong working relationships with the mental health sector and wider partners in the referral pathway. So I think you're really across the job sector and mental health sector, you can understand the kind of ebbs and flows of outcome achievement. It is very difficult, as I say, to achieve a sustainable employment for someone with severe mental health, like with severe psychosis, for example. Getting a job in the first place, like many of these people have never maintained a job in their life or have never attended a job with appropriate accommodations for their condition. So I think this is quite phenomenal, and I think it requires someone to have that real nuance of these complexities. I think what's really important, and I think the MHEP team in the interviews, and I think Maddie also expresses this, is valuing the spirit of learning and active problem solving. And I think that's also what Russell embodies. So I want to give a shout out for him. And rather taking that maybe a very historical approach to commissioning was maybe slightly punitive or slight contractually, or very, monitoring new public management, while we're really shifting into more of a kind of empowerment approach, a more learning approach. And I think that's what an ideal commission should look like.
Thank you so much for that, Emily. I saw Shamsia's hand went up at one point, so I'll come to you very shortly, Shamsia. Unless, are you picking up on something Emily's saying? So I have a question I want to pick up from the chat.
It's just a point around commissioning, actually.
Great.
And so just a general comment about, actually, commissioners are such a key stakeholder in all of this, right? Because you get what you commission for. Despite all the goodwill of service providers and intrinsic motivations of their staff and their organisation, ultimately they are guided by what the commissioners have commissioned and what the contract says. And I think this is one of the real great advantage and benefits of an outcomes-based contract, and particularly around employment, because what the commissioner is saying is, we trust you, the service provider, you deliver these services, you know the community, we trust you to deliver the intervention, design the intervention and delivery as you see sort of best fit. What we want are these outcomes, and all the stakeholders are very clear on what the outcomes are, what the definition of success is right at the beginning, because you're defining success with the commissioner based on those outcomes that need to be achieved. So I think just in terms of what makes a good commissioner, outcome-based contracting in so many ways lends itself to a good commissioner, because it's about trusting your deliverers, it's trusting your service providers and your implementers and working in partnership with them. Your strength is a commissioner, their strength is delivery, but we all want the same outcomes. And I think it's just a really important point worth making.
Thank you. And it is something that we are seeing across, I think, the Life Chances Fund more generally, that it is quite and resonant, given the new UK government's interest in devolution of this has been an outcomes fund that's being delivered with central government still accountability, that there's been shared outcomes put at the heart of each programme and of the work. So that's clearly defined, like defining the good, which we would hope all of our policy would do. But then there's this more local flexibility. It's being delivered on the ground and more like locally defined by those who are actually close to the work. Amita, we had a question from you in the chat, particularly around, I think, aligning partners. I didn't know if you wanted to come off mute and ask it to our panel, if you had any reflection.
Sure. Well, thank you very much for the very interesting discussion. Yeah, I was wondering about, I think you mentioned that in this program, there was, I think on one of the slides it said that it took a year for all of the partners to really understand and align around the goals, or to understand the program properly. I don't know if I picked that up properly. And so I was just interested in how much of time was spent early on, and what best practice is as well in terms of mission alignment. Thank
Great.
you.
Emily or Madeline, do one of you want to hop on that first?
I think I will leave the majority of the answer to Maddie, but what I will say is that there were several managers in MHEP, and I think each manager in MHEP had a slightly different approach. I think what was really important was more kind of person-centered performance management, and so the ability to attend in-person meetings and also to situate the performance manager as, hey, I'm here as a supporter, as a collaborator of performance, rather than as a monitor or as a parent or as someone kind of breathing down your neck. I'm really a supporter. So if you are having low performance, we're not telling you off. We're going to ask you, how can we support you? Like, what's the reason, do you think? And we will call up the commissioner, we will call up people, so I think that just slight breakthrough in kind of person-centered performance management helped with mission alignment. I think the fact that some providers stated that it took a year to understand MHEP is just because a lot of these are third sector providers. A lot of them didn't necessarily have very sophisticated data systems prior to MHEP. And so I think the real rigorous focus on outcomes was a kind of shock. And I think it took them a year to really get them up and running, to be able to be at the level to succeed. And I think that's, perhaps the level they should have been at, or should have been encouraged to be at by their commissioners previously. I'll pass on to Maddie.
Thanks, Emily. Yeah, thanks for a great question, Amita. And I want to also emphasize that, yeah, I've been involved with MHEP for its sort of final 18 months, but Emily mentioned, yeah, I wasn't around at the beginning, and it's been around for a long time. And actually, it's worth emphasizing that, yeah, the project went for around 4 years, I think, was the length of the contracts. And obviously, 18 months of that was lockdown, or was sort of the height of the pandemic. So there was a lot of transition and big risk of sort of, I don't want to say mission drift during that period, but the contracts went live, I think, on the 1st of March 2020. So you can imagine how people's focus and engagement with what was possible around achieving employment outcomes maybe shifted in those early months and years of the program. But despite that, I think, yeah, I would say that I would emphasize that certainly in my time in the project, and from what I understand from colleagues who worked on it earlier, I think the culture shift of working in this way was significant. Emily's already talked a little bit about why it's significant from the perspective of providers, but also it's a completely different way of paying out contracts. It's a completely different way of engaging with contracts administratively for a local authority. So local authorities commissioners are sort of perhaps a little bit more used to bringing performance data to a discussion about how to deliver a good service. And suddenly we worked with some amazing commissioners who were very comfortable from the outset in working in the way that we wanted to work with them, in a very outcomes focused way. And they're thrilled to have the data that they'd always wanted, to have the capacity to build around these services and their engagements with providers. But paying in an outcomes based way and delivering the contract administratively was very different to ordinary ways of working for a local council. So that also created some, we would have mission alignment with a group of people who are in the room for these discussions, but there are big pieces of infrastructure, particularly big providers who have big contracting departments on their side, meeting big finance teams on the local authority side. Like when they come together, they haven't necessarily been part of those mission alignment discussions. And I think that was perhaps where some of the confusion creeps in, is that you don't always actually have the exact right person you needed in the room to explain the mechanism when you set up with those very exciting initial mission focused chats, because these contracts are actually delivered by like an army of people who serve different functions in local authorities and in big national providers.
So just in terms of follow-up, do you think then, in terms of takeaway for the future, for a project of this size, does it make sense then to sort of allocate more time initially in the sort of design phase for mission alignment, or what would the takeaway be? Thank you.
Interested in your thoughts, Emily, but I would say, yeah, I mean, again, I want to emphasize that I wasn't there in those early discussions, and I don't want to comment on what we did. And I imagine there was a lot of emphasis on mission alignment, but I guess my takeaway would be to really think about not just the conversations that need to happen between a commissioner and the team manager and a provider team, but also the conversations that need to happen between your invoicing team, your head of finance, and mapping out sort of all of those the people who need to be involved in making it function.
Excellent. Thank you so much indeed. Yeah.
Exactly. And I would just add on to what Maddie said in terms of asking providers and commissioners what an ideal outcome-based contract would have looked like. many stated that a 6 months mobilization period for really understanding some of this mission alignment, but also maybe rejigging some of their organization development systems and processes would have been helpful.
Thanks. Let's go to Russell, but I think maybe worth adding, generally, I think it's a useful reflection of thinking, well, it was a COVID context. Everything was incredibly challenging at that time, and it can be easy to forget, but like the additional complexity, especially for this target cohort, I mean, is unimaginable. And then I think another thing just worth reflecting on is anyone doing something new, putting new processes in place is going to take time. So adequately resourcing that, whether that is a SOP or something else, it's worth thinking about. Russell, let's go to you. And then while we hear from Russell, panelists, let me get you ready. I'm going to come to each of you because I'd love to hear sort of a concluding thought. With everyone in the audience, we've got a whole range of people, but we really care about making this practical, applicable, and actually enabling and helping other people to do better practice. What is one thing you would want the audience to take away for today? But Russell, let's first of all hear from you, and then we'll hear everyone's takeaway.
Yeah, I think mission alignment's a really interesting framing of it. And I suppose what, coming from a kind of non-outcomes contracting context, what I would say is people often think commissioning is just the buying of the service or the sort of contract management of it. And there's a lot of misunderstanding of sort of what we do. Direct colleague calls it the dark arts, though I wouldn't put it quite that way myself. I think for me, there's something about how do you do that kind of engagement with providers right from the start of the commissioning cycle? So in the UK, we talk about sort of the commissioning cycle as being analyse, plan, do, review. And I think for me, there's something about, you know, how do you go out and do soft market testing? How do you go out and visit services that are similar to what you might want to do to draw up some of that thing? And I think there's something about understanding your local market as well in that context. And then how you design procurement processes can similarly, I think, help or hinder some of that alignment. So I worked in a council once where we did kind of a 3-stage process rather than a 2, which involved and I will say prior to that, there was a lot of market warming, which I think really made a difference and got people ready to what we wanted to do. But there was sort of an initial submission, then providers were shortlisted, then a kind of negotiation stage almost, where commissioners could go in and ask questions of the providers about their model, and providers could ask commissioners questions. And actually that was really powerful on both ends, because I saw through it both changed their minds about different things. And then that was providers got an opportunity to resubmit a bid into a final sort of best and final thing, and then that was a final evaluation. And that was a really obviously not in an outcomes focused way, but in sort of a more traditional procurement exercise way of getting some of that alignment. And what we found was that was really beneficial from the start, so that both parties understood the different things. So I would say, regardless of context, yes, it is worth investing energy up front, I'd say, to get some of that
Thank
alignment.
you so much for that, Russell. Emily, given you kicked us off, I was wondering if we can go to you first on your takeaway for our audience, if there was just one thing you want to leave them with.
I think there's many things I want to to pass on, but I think, you know, there is something about trying to improve commissioning practice. And, you know, maybe IPS contracts, as it's stated in the report, you know, outcome-based contracts is just one tool of many tools in commissioning proper services. But I think what can be taken away is from MHEP is a couple of key points. I think one is like data analytics. I think if we invest a little bit more on having the ability to see data through data platforms such as the IPS Grow toolkit, and trying to allow providers to be more empowered to use data to shift and adapt their service delivery according to performance, and not in a way that's, you know, your contract will be taken away, but how can we improve as a service? And that continuous service improvement cycle is really important. And the only way to do that is through data. So I just say.
Thank you so much for that. Madeline?
I was just frantically trying to type together my thoughts into a punchy statement. I think certainly my takeaway from from the MHEP project, and certainly this has been sort of affirmed and made more nuanced by the amazing work Emily's done. I think really taking a step back, sort of two things really matter for us to be able to deliver really great services that achieve good outcomes for people. And I think those things are that money is available to fund those services where it often currently isn't in a tight funding environment. And also, to Russell's point, that we are able to commission those services really well and sort of deploy the full range of creative tools that commissioners have to make sure that those services get us what we need. And social outcomes partnerships are a way to do both of those things. They are a lightning rod for bringing in private investment into or sources of capital that otherwise aren't there into this sector, and they're also potentially a very powerful tool to create the conditions for more creative commissioning. And we know so much now. We've got over a decade of experience in designing them well, and I think MHEP is sort of another really rich source of evidence about how to do it well and what to learn from. And so I wanted to say, I think there's still, although there's a lot of criticism of these kinds of vehicles, I think they remain really exciting and a very powerful tool to deliver good public services.
Thank you so much for that, and appreciate the comment of our research being really helpful, hopefully for driving forward best practice and also learning from what hasn't worked or has been challenges so that we don't just replicate that. Shamsia, let's go to you.
Great, thanks, Jess. I haven't even tried to do what Maddie did. I haven't even tried to write any punchy summary, so it's going to be off the cuff. Cheekily, can I have two? And they'll be quick. The first is from sort of the MHEP report is just, if you're not familiar with the IPS model, it's a great model. It's a bit of a shout out to the IPS model. So please do look into it. And there's a couple of things that really struck me as in terms of the IPS model. Firstly, it's the place then train approach. You know, this is putting people in competitive employment, supporting people in competitive employment manage their mental health, which is a really important aspect. And the other part is the integration of the clinical team with the employment team. And too often our services, going back to the fragmentation question, are fragmented and siloed, and our individuals, our job seekers aren't. They're dynamic and they access services, a number of services, and IPS actually brings the clinical and the employment service together around that individual. I think that's a really powerful tool. So that's sort of one takeaway from MHEP, is a shout out to the IPS model, and have a look at that. The other, I guess, is alluding to my first point. MHEP, it is complex and more complex than perhaps some other social outcomes based partnerships are, and you can see why. I would just say, don't let that leave you with the view that outcomes based contracting is necessarily a complex tool, commissioning tool. It necessarily isn't, and can be simpler.
Thank you. Russell.
Yeah, just to say, Shamsi, I love that framing of dynamic. It feels much more positive way to talk about these residents than some people sometimes do. So yeah, really, and I agree with the IPS model being really promising. I think for me, the key takeaway would be that good commissioning takes time and investment, whatever model you do it with, and sort of relies on those enablers that Emily talked about around data. So I think there's something about in a climate where the public sector we know continues to be stretched, I think the reality is that probably there has to be choices to be made, because I think relational commissioning is very powerful, but actually there's only so much time and so much whatever. But what I would say is it's worth the investment. So I think, do think about services where it is really important to drive some of those outcomes and plan accordingly.
Thank you so much for that, Russell. And something I said at the start of the session is that I really cared about this being interactive. And so I wanted to take a moment just to pause and invite all participants to share in the chat maybe a word or a phrase that they're taking away off the back of this session. I can keep rambling, but it'd be so nice if you can take a moment. It can just be that you're intrigued. It could be that you want to explore more. It could be that, yes, come on, be our Q Russell's model. Please do just start popping that in the chat, because we care about making sure we make space for you to think about what your takeaways, what can you implement, what might you not implement, what is a word or a phrase. So While you do that, I will also just mention that we have a feedback form that John has very kindly already popped in the link in the chat, and we will be circulating that. Nice, we've already got some curiosity procurement, but it is incredibly helpful for me and for us at GoLab. We'd love to hear your feedback, especially what did you find helpful, maybe what did you not find helpful, how come you came along. So even if you can just take 1 minute to let me know now or later, we'd be so grateful for that. But do keep popping your thoughts in the chat. So yeah, nice. Sally, great. Integration, critical at the design phase. So good. Another person, Eileen, taking away the work approach and the description of procurement approaches. Emily, motivation for the final report, which will be coming soon. So do look forward to that. This absolutely keep going. It can be one word or a phrase of what you're taking away from today. Next report, looking forward to that. Alignment, nice. We talked a lot about partnerships and alignment of stakeholders and outcomes focus. Performance versus contract management. Yeah, I think there's been a really important articulation, especially with the live learning. And I think something Emily said very early on, if I find my notes right, yeah, that there was almost sometimes in the past that commissioners talked about how they actually allowed in some ways underperformance, but that this really put it back at an aligned center for people. Governance and commissioning and the place of that from Sam. Do keep going and fitting your thoughts in the chat. Wonderful. And then while you keep doing that, John, could I ask you to pop up our final slide? But do keep popping your thoughts in the chat. I hope that it's a really helpful exercise also for you to think like, what is the feeling I'm taking away from this? What is the thought I'm taking away from this? What's the action? Whatever that might be. It can be a word, a phrase. So this is part of our wider series of engaging with evidence. We will be having more this year. If you have something like a new piece of research that will be coming out, please do get in touch with me. We'd love to see about doing a session on that. But you can sign up to our newsletter to stay in touch. And that is also the QR code for that feedback that I encouraged you to give me on the session. And I wanted to say a massive thank you to our panelists. I know that this has taken time, you take thoughts, that you take care to share what you've shared today, not just the time of the actual session. I'm really, really grateful for that. Massive thank you to Emily, who has been working incredibly hard on finishing this final report on the same programme and has just been sending off an initial draft of that while also then coming in to deliver this session. So a really big kudos to her. So great to see people keep still putting things in the chat. Please do keep adding them. And then finally, a thank you to all of you, our wonderful participants. It makes such a big difference to actually get to hear from you, to learn from you, to see what you're taking away, to hear where you're joining from. It wouldn't be what it is without you. This is very much a peer learning space. And so we would love to see you again. And if you want to connect with us further, we're on LinkedIn. We have a monthly newsletter. If you want to hear more from me, I do a weekly policy newsletter as well from GoLab that you can sign up to. But all in all, a massive thank you. I hope you have a lovely rest of your days, and we will be stopping our recording here.